All right, hello everyone. My name is Darien Colquitt, and I will be presenting Lyme disease. So, what is Lyme disease? Now, Lyme disease is an infectious disease classified under the genus Borrelia. Borrelia is a genus of bacteria of the spirochete phylum and is primarily transmitted by ticks and lice. More specifically, Lyme disease is caused by a spiral-shaped bacterium called Borrelia burgdorferi. The pathology of Lyme disease is that after the Borrelia is injected, it spreads through the body and is injected by a vector, as seen here by these ticks. Now, origins of Lyme disease. Lyme disease dates back actually thousands of years. A recent autopsy was conducted on a mummy that was 5,300 years old and was found to have the Lyme disease. A German physician, Alfred, first described the chronic skin rash or erythema migrans of what is now known to be Lyme disease more than 130 years ago. Despite all of this, Lyme disease was only recognized in the United States in the 1960s and 1970s, making it relatively new, and the bacteria that causes it, Borrelia burgdorferi, wasn't officially classified until 1981. What are the symptoms of Lyme disease? The first few symptoms are commonly acute symptoms, which includes a mixture of cephalgia, headaches, or swollen glands, fever, rash, fatigue, and aching joints and muscles. After a couple of weeks or months of initial exposure to the bacterium, or when the first symptoms appear, some may experience symptoms that affect the heart and or the nervous system, so the cardiovascular system, the nervous system. There are also some developing neurological disorders or encephalopathy that may be manifested by cognitive disorders, sleep disturbance, fatigue, and personality changes. A person might develop inflammation of the membrane surrounding your brain, which is meningitis, or temporary paralysis of one side of your face, Bell's palsy, numbness or weakness of your limbs, and impaired muscle movement. Okay, some more symptoms are some get blepharitis, hepatitis, and severe fatigue and unexplained heart problems. Chronic symptoms include joint pains and neurological damages. Health problems like neurological, dermatological, cardiovascular, and psychiatric symptoms rendering it difficult to distinguish it if the patient indeed has Lyme. As mentioned, there's a variety of symptoms. Here you can see erythema meninges. The erythema meninges, and that is the bullseye that we see on the screen, the bullseye rash, which is commonly known as that. Treatment of Lyme disease. So currently, there's actually no known cure to Lyme disease. However, treatments exist. Prescription antibiotics such as doxycycline, sulfarizine, amoxicillin, and ceftriaxone by injection may be used to combat Lyme disease. Currently, there is no reliable test to determine if has contracted Lyme disease or if he or she has been cured of it. There are herbal creams, however, that can be used to decrease irritations of the dermis regions to help, with the rashes. There are various other treatments depending on the symptoms. It is important to see an appropriate medical specialist. An example is in regards to arthritis, it's best to seek help from a rheumatologist. An infectious disease doctor would help provide treatment for various infections, including those tropical in nature, and a neurologist may also help with treatment of some of the chronic symptoms involving the nervous system, as previously mentioned. So, we've talked about some of the treatments, some of the symptoms of Lyme disease, but how can we prevent Lyme disease? Some ways to prevent from getting Lyme disease is avoiding exposure to areas where ticks are found, such as wooded regions. I want to say that areas are more common in the west coast of the United States. If ever found in these areas, a person must make sure to cover up by wearing long sleeves, gloves, anything else that may protect the skin or any dermis region from these small insect bites. Applying insect repellent is also helpful, but a person must be sure to keep these harmful chemicals away from their optic regions and other extremities. After outdoor activity, it is important a person checks themselves and to never assume immunity. And by this I mean we're all at risk. Make sure you check yourself, make sure that you shower, check every area of your body. Disease can happen to anyone, and it is important to treat any medical topic with seriousness. If a tick is found on a person, it should be removed immediately by using tweezers. The tick should be grasped close to his head or mouth and pulled out gently without crushing it. This prevents any liquid from being injected into your body. All right, guys, this is the works cited. I believe I used about 10 different sources. Thanks for listening to my presentation about Lyme disease. See you next time.